Joining us live now to talk about all of this is Dr. Andrew Mulwa. He's the Director of Medical Services at the Ministry of Health. Dr. welcome to Sunday Live.
Thank you very much, Jeff and Victoria.
Oh, absolutely. Dr. there's been concern about the newest ambition by the Ministry of Health to get at least 1 million people vaccinated since February 3rd. What has that yielded so far? Have you managed to hit that target?
In all honesty, we have not been able to get 1 million vaccinations per day, but we have been able to see a rapid improvement of the number of vaccinations that we are doing in a day, moving up from an average of about 80,000 per day to more than 200,000 per day. I think the bottom line is we have what we launched with the Ministry of Interior is a concerted effort to ensure that all eligible population are vaccinated within the shortest time possible, and the vaccines that are within the country are utilized within the shortest time possible. The ambitious target of 1 million vaccinations is still possible, and we have seen vaccinations on some days go beyond 250,000, 254,000 precisely, the highest that we have recorded. And we look forward from this collaboration to have this exercise ramp up, and we get to the 19.5 million vaccinations sooner than June as we had initially planned.
Dr. Mulwa, you had said by 2021, at the end of 2021, there'll be at least 10 million vaccinated. Did you reach that target?
Yes, we reached 10 million by the end of December. And these vaccinations were done across 10 months. In the last 6 weeks only, we have been able to vaccinate 15.3 million people within 6 weeks, which is a positive move in terms of when you compare what happened in 2021 and what has already happened in 2022. Because the first 6 weeks of the year, we have already done 5.3 million vaccinations.
And just for the sake of clarity, what about the vaccine stock in the country? We had seen those numbers of AstraZeneca, Moderna not being available, but others on the market. But what's the stock looking like right now?
Currently, in the central stores, we have about 3.5 million vaccines. In the regional stores, another 3.5 million. And in the counties, about 2.5 million vaccines. But the pipeline is promising. We are expecting 8 million Pfizer vaccines from US through United States government through the COVAX mechanism. We are also expecting the Johnson & Johnson 12 million through the AVAT mechanism, which is the vaccines that has been procured by the government of Kenya through the African Vaccines Access Program. So we have 12 million vaccines that we expect from that mechanism, and we also expect more vaccines from the COVAX mechanism, which is the WHO Gavi mechanism of distribution of vaccines to this country.
So how soon for those vaccines you've just mentioned?
Like for the Pfizer, we have 8 million between now and August. So will be spread as per the country's need, because one thing that we are very careful as a ministry is not to have vaccine expiries within our shelves. And therefore, we are only taking in vaccines that have long expiry for the time being, an expiry of 90 days for the time being, because what we have in the country is already enough to run us for quite some time. So we have a weekly review of the pipeline. And we think in terms of when the vaccines are available is not a major issue, because the pipeline is now stable, and we only open up for receiving vaccines when we feel that we are utilizing. This has happened in many African countries where vaccines are donated and vaccines expire in the shelves. We are lucky as a country to say we actually have not had any significant expiries within our country, and in actual fact, we have had a positive. We have vaccinated more, because when you look at a vial of 10, sometimes when you do the actual vaccinations, you get 11, 12. We have actually vaccinated more than what we have received in terms of the numbers.
Dr. Mulo, just read there's a positivity rate in the country of 0.9%. How does that compare to other countries?
Generally, across the African continent and across the world, the COVID-19 wave is down. We would say we are off the fourth peak of COVID. We are at the tail end. But this is not to say we are done with COVID-19. Of course, from the first infection, the first wave, the second wave, we've seen periods that we have 2, 3, 1 month. Sometimes between October and November, we had like 6 weeks where we were recording below 2% of positivity. But come mid-November, we started seeing increase of cases. So what I would say is we are down in terms of the COVID-19 cases, but we are not off the hook as a globe and as a country. So people need to continue keeping the guard, washing hands, social distancing, masking, and vaccination as the ultimate solution to beating this pandemic.
I mean, many would wish that you would say that we are close to the end of COVID-19. But, you know, when can we start to see a lifting of many of the restrictions? You know, I guess when enough people are vaccinated. Of course, many people are hoping that with Omicron, because it's more transmissible, more people are getting it and building more natural immunity. Could that be the silver bullet to seeing the end of COVID-19?
The scientific approach would not be natural immunity, because that would be exposing the population in the first place. So the scientific approach would be what we know has been tried and tested. Remember, even as we say, Omicron has affected a lot of people. We have only tested 322,000 positive Kenyans out of a population of 53 million people, meaning all 53 million have not been tested positive. So what we don't know is, of this natural immunity, what is the percentage that has been affected? The best shot and the best way is to do vaccinations, acquire herd immunity, so that everyone within the community is protected by those who are vaccinated. Natural immunity is good, but we cannot scientifically rely on natural immunity, because that will be exposing the population. Again, we are just lucky that Omicron variant was less virulent and was less deadly, and we don't know. Who knows what the next variant will be? It could be more virulent, it could lead to more deaths. So taking natural immunity as a way of protecting the population would be a very risky venture scientifically.
Dr. Muller, real quick, in other countries you see a lot of anti-vaxxers, people refusing to take the vaccination. Do you see that here?
They're here. They are here. There are certain religions, religious beliefs that people don't believe in conventional medicine. We have seen this, especially in this current campaign. So we have also seen people who are generally anti-vaxxers for other reasons. And the anti-vaxxer movement globally is very, very strong. The beauty about our country and this part of the world is we are a routinely vaccinating country. 90+% of our children are vaccinated against childhood illnesses. So vaccinations are not a new thing in our environment. But in some parts of this globe, there are many parts that routine immunizations are not done. Us as a country, we are doing vaccinations for even malaria, which is a new vaccine that has just been introduced. We are doing vaccinations for HPV, against cervical cancer. So as a country, we have been vaccinated. But remember, we do not do routine influenza vaccinations like the rest of the world. So this adult population getting vaccines, because all these vaccines that I'm talking about that we routinely vaccinate are vaccines against early childhood illnesses and younger population. For adult population, we don't do routine vaccines like the influenza, what happens in the West. But now I think COVID-19 brings us all together in that table that we may in future require to get a shot or another every year. Who knows? We do not have enough scientific data to know how many boosters one will require to say, indeed, I am safe. But like for the influenza, you have to take your shot every year.
Every year.
Yeah. Some countries like Israel, they're going for their fourth booster already.
Exactly.
Right?
Yeah.
Yeah.
You see us going that way?
It's all scientific evidence. When the antibodies that you develop after vaccination go down after 6, 8 months, 9 months, then the best option is to boost yourself with another shot so that you have antibodies against this disease. As long as the disease is around, we may have several cycles of vaccination. The best shot is to have 70%, at least 70% of population fully vaccinated. At that point, the 30% that is not vaccinated will be protected by these 70%.
How many shots have you got?
I have done 3. I got my booster shot on the 31st of December.
And you mixed it up like most of us,
AstraZeneca and Moderna.
Fantastic.
All right, leading by example. Thank you so much, Dr. Mulwa, for your time.
Thank you, Jeff.
Appreciate it.
Victoria.
Thank you. That's Dr. Andrew Mulwa there. He's the Director of Medical Services at the Ministry of Health, giving us the latest on COVID-19.